Chair, for the opportunity to contribute to this important discussion today. Today, we speak on behalf of the partners of the Fight the Fakes campaign. Fight the Fakes is a multi-stakeholder campaign supported by organizations representing healthcare professionals, disease-specific organizations, research institutes, product development partnerships, foundations, coalitions, non-profits, wholesalers, pharmacists, and private sector. Fight the Fakes partners support falsely labeled, falsified, counterfeit medical product as a key contribution towards an effective fight against fake medicines. We all know that fake medicines are a public threat, health threat, and as they put patients and the general public at risk. Patients exposed to fake medicines believe they are receiving general treatment, but instead they are getting potentially dangerous products and could increase resistance for real treatments and cause further illness, disability, or even death. Fake medicines undermine patients' trust in health systems, their government, healthcare providers, and manufacturers of genuine medicines. Fight the Fakes partner believe that a comprehensive strategy to combat manufacturing and distribution of fake medicines requires an active participation that involves all stakeholders and should leverage several competencies at both local and global levels. Medicines and vaccines counterfeiting is a crime against patients, and producers of fake medicines are criminals. Tackling fake medicines requires strong policies, legislation, and penalties for those producing fake products. Robust coordination among international organizations is vital to ensure this problem is correctly tackled. As the leader on global health matters, the World Health Organization has an unparalleled role to play. Fight the Fakes partners stand ready to support WHO members in increasing awareness and understanding of the crime and protect patients from fake medicines worldwide. Thank you.
Thank you. Thank you, Chair. Honorable attendees, I speak on behalf of the International Pharmaceutical Students Federation, IPSF, representing the global voice of 350,000 student pharmacists and recent graduates. IPSF welcomes and supports the proposed action plan and encourages all stakeholders to adopt the draft resolution recommended by the Executive Board. IPSF is concerned about the current inequity in access to essential medicines that is hindered by the economic nature of the private sector, as it does not reflect the societal needs. Therefore, innovation must instead be driven by novel business models, linking the cost of research and development from the price of medicines, as highlighted in a CEWG report. Using neglected tropical diseases, burdening mostly impoverished communities as an example, access and research gaps highlight the deficiency in our current R&D system. In order to bridge these gaps, IPSF calls for greater investigation into opportunities for open research initiatives and public-private partnerships to ensure cost effectiveness. IPSF also calls upon the distinguished delegates to plan for harmonization of quality and safety requirements of medicines as a means to support the continuity of manufacturing and supply processes. We believe that it would prevent drug shortages, thereby ensuring consistent access to essential medicines. Thank you for your kind attention.
Thank you.
Mr. Chair. Thank you for the opportunity to speak on behalf of the International Pharmaceutical Students Federation. As we approach a turning point in the international development agenda, the centrality of human resources for health should be prioritized to achieve universal health coverage. This is vital and has been acknowledged through the received declaration. IPSF welcomes the outcome document of the third Global Forum on HRH and would like to call for the following 4 actions. Firstly, including us as healthcare students and recent graduates in further defining HRH strategies and plans, because we are the only stakeholders in the position to revisit the entire pre-service training. In addition, we are a susceptible group that has to confront increased health service demands and for the HRH crisis at the very early stages of our professional careers, despite having little to no training in interprofessional practice. Secondly, the quality of pre- and post-service education needs to be equally prioritized with the quantity of trained healthcare personnel. We emphasize our support for interprofessional education as a means for developing collaborative practice approaches to improve health workforce competencies, patient outcomes and safety, while practicing within the respective professions on a healthcare team. Thirdly, evidence suggests a correlation between interprofessional practice and improved patient outcomes. Therefore, IPSF calls for further investigation on the most optimal approach to implement pre- and in-service interprofessional education to shape patient-centered collaborative practices. Finally, IPSF calls for the revision of healthcare profession roles and recommend member states to reform the legislation allowing respective healthcare professionals to maximize their practice potential. Alongside supporting these actions, IPSF commits to bringing student and professional healthcare organizations together to further develop interprofessional education and interprofessional practice policies in hopes of serving member states with a unified voice for those who work towards ensuring patient safety. Thank you very much for your attention.
Thank you very much. The last NGO is International Pharmaceutical Students Federation. Please.
Dear Committee Chair and attendees, thank you for the opportunity to speak on behalf of the International Pharmaceutical Students Federation, IPSF, representing the global voice of 350,000 future pharmacists and recent graduates. IPSF recognizes antimicrobial drug resistance, AMR, as an urgent global health threat requiring immediate collaborative solutions. Hence, IPSF welcomes and supports the proposed action plan and encourages all stakeholders to adopt the draft resolution recommended by the Executive Board. We would like to call for the following three actions. 1. IPSF calls for the greater investment in developing novel antimicrobial medicines through the revision of current business models of R&D as proposed by the Strategic and Technical Advisory Group on Antimicrobial Resistance. Only joint efforts by the global community executed through open innovation research with a focus on creating new compounds and salvaging pre-existing regimens can tackle this threat. 2. IPSF supports the implementation of regulatory instruments as proposed in the work plan of member states on the substandard, spurious, falsely labeled, falsified, counterfeit medicines to combat illicit antimicrobials that promote antimicrobial drug resistance and thus sabotage global efforts in reducing the burden of AMR. We call for increased regulation, education, and availability of technical instruments assessing the genuinity of medicines in order to halt this problem. 3. Evidence for the presence of AMR in communities where antimicrobials can be obtained without prescription is present, as disclosed in the WHO's framework on rational use of medicines. IPSF calls for greater public health law enforcement, assuring prescription and dispensing compliance with evidence-based clinical guidance. Application of the joint FIP-WHO guidelines on good pharmacy practice can support these efforts, providing information about the appropriate use of antimicrobials to consumers and prescribers. We believe that only universal implementation of these fundamental steps holds the potential to truly contribute to the global action strategy on AMR.